College students need help recognizing health problems and being aware of the healthcare services available on campus. They find the whole process really complicated. Our project aims to make the primary care system more accessible by guiding students to make decisions that benefit their physical and mental health by creating different contact points for primary care in the college community. In 2021, 41% of college students showed signs of depression. Also, a lot of the time, students are unsure as to what is the right time to seek help from a doctor, and they shy away from it. Only 23% of the students were aware of the health services available to them and knew whether they needed to seek professional help or not. College campuses provide students with environments that may lead to unhealthy lifestyles, such as exposure to unhealthy food, unhealthy work environments, tobacco, alcohol, and drugs. Medical resources have received less attention and have been lacking for a long time. Students sometimes do not know how to access and correctly use them. Psychological problems also contributed to difficulties in accessing medical resources. Students may ignore or deny health problems due to stress and anxiety. They must overcome anxiety, fear, numbness, and other psychological factors to seek medical treatment. Lack of health awareness also prevents students from recognizing their health problems, thereby preventing them from actively seeking medical resources or adjusting their living habits. Our solution to these problems is to create a safety net within the student community, which provides quick support to those facing health problems at different levels. Our overall design leans towards creating different contact points for primary care in the college, thereby improving access to the health system and creating a healthier community. Our intervention lies within the design continuum's information, product, and urban realm aspects. In terms of the experience continuum, we are addressing the issues between when someone realizes they need medical attention till scheduling an appointment. We referenced point of decision design and also took inspiration from open world game guidance. We found out that some points of attraction can lead students to make healthier decisions naturally. By attracting attention and providing services, students are consciously guided to facilities that provide health services and let them make healthy choices, thereby improving their health. Students navigate to all these points of decision through a health app. The health facilities are placed in a conspicuous way where there are many student activities, like the staircases and washrooms in the studio spaces, to attract students to use them as much as possible. The student's health is monitored, and the decision that best suits their case will increase its attractiveness on the app through lights, sounds, notifications, and navigation. Also, they could be guided from one point of decision to another in a chain of health guidance. The phone app can produce a pleasing effect for a long time. It also can give health advice and other health facility information to users. It is used as a starting point for guidance, but it also can store health examination reports, availability, and information on the surrounding health facilities. The healthy living facilities will be scattered across the campus in communal areas, attracting students to use them to improve their health. These healthy decision points include food stations, bicycle rental stations, provision of disinfectant, and rest areas around study spaces. Physical examination equipment can help students understand their health conditions, enhance health awareness, and discover health problems promptly and accurately. Professional equipment will be arranged where students may stop and rest. These decision points will be larger and more conspicuous than the general facilities. A complete medical kiosk is the best campus health protection. It is rare in number, but it is located in places with intensive student activities, such as activity centers, building connections, and circulation corridors. It is set up with green rest spaces and leisurely environments. This way, they will be more attractive to students. In addition, for students with health risks, mobile apps, health facilities, and other signal sources will use navigation and other prompts to guide students to the medical kiosks actively. Attraction decision points and each student's health guidance chains will form a community health network. Ordinary students can find health facilities around them at any time and use them to influence their living conditions and make their lives healthier. Students facing health problems will receive more attention from health facilities to guide them to adjust to a healthy living state. Medical kiosks and medical personnel will also be ready to help them. We were moving from the digital to the physical space. Here, we have a conceptual rendering of the microenvironment we are trying to create. This space will include rest areas and spaces for indoor games to keep the Wolverines motivated during reviews and examinations. The health kiosk is an integral part of this space where the exterior would remain activated, and people feel well about using the health service available. The kiosk would be a soundproof private space with a translucent glass entrance to maintain privacy inside. It will also house a vending machine which could either be used to buy general medication or provide some healthy snack options. The internal space will be wheelchair accessible. Some vital features include a large screen with enlarged captioning to interact with the physician. Through the app, one can select if they want to talk to a physician they are familiar with. There will also be a handset and audio speakers if one intends to keep it simple and have an audio call with the physician. There are also storage spaces that the doctor can control, which will hold specific medical devices like a machine to check vitals, an inbuilt floor weighing scale, an instant thermometer, a dermoscope, and an otoscope for skin and ear infections. One can also scan the barcode on the app, which would log the student into the system, and the doctor will have the patient's medical history through it. The design is flexible with a retractable envelope which allows for locating the kiosk at different locations across the campus. The station will be modular, along with a built-in vending machine. The kiosk can be located in a game day environment during the football season around Taubman tailgating events at the Michigan Stadium. It could also be moved to a resident dining hall where it could be used throughout the year for promoting healthier food habits while also solving the primary cause of connecting students to primary care. Since these kiosks are an integral part of the system we are trying to create, it is essential to take advantage of their portability. Establishing such a community health network is the most consistent with our definition of community health. Everyone can live better, but when someone falls behind, we all need to give him a hand. We hope this campus health network can help every college student live a healthy life.